Okay, so I have been asked to share with you today a topic that is of growing interest, antimicrobial resistance, in both the animal and the human health aspects, because we will know that it's a growing public health concern. So the topic of antimicrobial resistance, and I will refer to it by AMR in the slides that I have to share. It is now considered a health and developmental threat, particularly in developing countries, and we'll see why now. WHO, the World Health Organization, has declared it a top 10 global public health threat, and there's ample reasons why it is like that. And there's also multiple factors that will lead to antimicrobial resistance. We will revisit some of them today. But primarily, if you want to sum it up in one key factor that's leading to this now, is the misuse and the overuse of antimicrobials, of antibiotics. And as I said, it's a host of factors that lead to the misuse and overuse. And I think COVID-19, as we are still in the pandemic, is perhaps the best example for the misuse of a key antibiotic in our arsenal, and that is azithromycin. You know, you saw many patients being treated with azithromycin, or many patients taking azithromycin, which is a very good antibiotic, which I don't know, after the 2 years of misuse and overuse, I don't know what the success rate of treatment with azithromycin is going to be for bacterial infections that do need antibiotics. And of course, antimicrobial resistance has multiple effects on the health system, and we'll also revisit them briefly. So it has multiple layers of effects once you have antimicrobial resistance. Once you have that documented in a given population, you are more likely to have an increased death rate, increased disability. You can have a prolonged hospital stay, and this is primarily because patients do not routinely respond to antibiotics. So they will perhaps be requiring 1, 2, 3 different types of antibiotics before they get any better. Unfortunately, the more antibiotics you use and the wider spectrum of antibiotics you require more expensive medications that are not so easily available in our setting. And of course, the more aggressive the antibiotic is, the more side effects you will have, so that eventually patients can be hospitalized, not necessarily because of the antibiotic, but even the side effects that you can have as a result of those potent antibiotics that you sometimes have to use. And of course, the increasing resistance that you find will mean that you will have the current medications that we have easily accessible, routinely being used, are perhaps not going to be as effective as you would want. Other public health measures that eventually happen is that you have inadequate water and sanitation, poor infection control measures. These can also aid in people having increasingly resistant bacteria in our setting. And so I think there's 4 key factors that we can zone this into, right? Which is, and this is perhaps where the bridge to One Health is, because you can think that it's primarily a health problem, a medical problem, a hospital problem, but in reality, we'll know that there's multiple layers, and the One Health animal layer is very important in this, because we now know that there's an increasing use of antibiotic use in the food production industry, both animals and plants. And so you have instances where you're using it prophylactically, which means you're giving antibiotics to animals, using it in the plant or agriculture setting to prevent pest infestation, to prevent diseases in animals. So we're using it as a preventive measure. You are already triggering elements of resistance that can eventually ensue. When you have indiscriminate use in the community, when you have populations that don't take the medication as prescribed, when you have patients that are using it to self-medicate, as I use the example of COVID-19, and you also have patients that are having multiple other diseases, or as we are an aging population, the effect of an antibiotic is not going to be necessarily the same. Within the hospital setting, of course, you know that you can have more aggressive pathogens growing there. The fact that you're using antibiotics in a more widespread and prolonged fashion can lead to antibiotic resistance. We are now invading and doing more extensive procedure in patients, so that leads in itself to extensive antimicrobial resistance. And of course, the bacteria in the environment themselves, evolving species, that are reacting and evolving once you're getting used or exposed to fertilizers, contaminated water in the soils, antibiotics popping up in the watersheds, water systems. So all these are elements that you need to factor in that can lead to antimicrobial resistance. And I have one more slide that I think pretty much summarizes succinctly what I think I've been trying to deliver the message across, and that is that you would require a One Health response in order to have an adequate response to antimicrobial resistance. So in the top upper portion, this is a UN slide. You talk about those 5 elements where you require levels of interaction in order to avoid or prevent antimicrobial resistance. The human element, the food and what you're using in the feed sector, plants and crops, the environment, and of course, all the watersheds and aquatic animals. It is a global crisis. It does threaten sustainable development goals. And we might not want to see the link, but if you notice all the links that are there that talk about water, adequate health, adequate access to um, food security, all those elements that lead up to the sustainable development goals listed here, 1, 2, 3, 6, 9, 10, 12, and 17. You do require an integrated approach to ensure that we are able to curtail antimicrobial resistance. I'm not so sure we are seeing the light in that regard. The development of antibiotics is not as extensive as we would want, so that as time goes by, and unless we continue to take ongoing measures, I think the risk of having increasing resistance is going to be there. So you're going to have evolving bacteria, evolving natural resources, and again, the interactions I always keep highlighting of animal and humans, and animal and human health is going to be very important if we're going to have any success story in terms of curtailing antimicrobial resistance. So that's what I have to share. I hope that I have been able to give the message, to start to ring the continue to sound the bell, maybe is perhaps the best way to put it, because antimicrobial resistance is real, and we are very close to it on a daily basis. So thank you.
Thank you so much. And I am going